So you had a very interesting debate on heart failure with reduced ejection fraction. Should we go with ACE inhibitors or ARNI is going to replace ACE inhibitors? So sir, what is the current place on therapy of ACE inhibitors in management of heart failure, sir?
Look, so far we were rather convinced with the efficacy of ACE inhibitor in reducing mortality in heart failure.
Yes, sir.
And whether we added beta blocker or beta blocker plus angiotensin receptor blocker, ACEI always remained the mainstay of therapy.
Correct.
Now, in fact, came the ARNI, angiotensin receptor neprilysin inhibitor.
Correct.
A drug ARNI has come, and it has an impact on mortality and hospitalization over and above enalapril.
Correct.
But thing is that I believe that when enalapril could not demonstrate any efficacy, has demonstrated efficacy on mortality, and ARB could not demonstrate any efficacy on mortality, then why enalapril was not used and why ARB was used with sacubitril in ARNI inhibition?
Correct.
In ARNI. I think the combination of enalapril plus sacubitril would have been a better drug, and it could have been achieved much more spectacular results if we combine enalapril with sacubitril, not ARB with sacubitril. I believe the choice of enalapril was of choice of valsartan was only because it is industry sponsored trial, and valsartan is a molecule of the industry who is sponsoring the trial.
Correct.
So it is in fact not done. It is more a selection bias from the industry, not a scientific obligation.
So still, does ACE inhibitor remains the gold standard in these patients, sir?
Yes, I believe that ACE inhibitor should be combined with sacubitril. Should not ARB should be combination of sacubitril.
The patients who are on ACE inhibitor, is there any indication to replace them with ARNI, or we should continue with ACE inhibitor?
Yes,
sir?
if we believe that with ACE inhibitors we are not able to control the symptoms or control the frequent hospitalization, in that case we can go to replace that as it is advised by ESC recommendation.
Right,
but
sir.
ACC recommends that it should be done, it should be immediately replaced by that.
Correct.
But I believe that it is a fast track mechanism. It was the paradigm HF study was released in 1914. FDA approval in 2014, 2015, and it is a guideline recommended in 2016.
Correct.
It was two fast track mechanisms.
It was fast track.
It is a fast track mechanism, and I think there was some external influence on this fast track mechanism. This is my belief.
Right.
My belief.
Right.
Otherwise, there is no reason to go for such a fast track mechanism in doing everything in favor of it.
Yes. So ARBs have never been able to show mortality benefit in heart failure patients.
No.
But ACE inhibitors have shown. So
Yes, sure.
I think it is a very relevant point that ACE inhibitor could have given better outcomes when they could have been combined with sacubitril.
If we consider science.
Yes. Scientifically, it looks definitely like that. And I don't think any company is working on producing ACE inhibitor like enalapril combination with sacubitril, but definitely they could have better outcome theoretically.
It will not come because enalapril is not a patented drug now.
Correct.
So who will give you the fund to combine enalapril with sacubitril?
Correct.
Scarcity of fund, scarcity of science.
True.